All right. Hello. Hi. My name is Christy Noble. I am from Atlas, and I am the Client Success Manager. And I'm going to try to give you some high-level details about what we have to offer and assist you with your patients. Okay. All right. So first, a few years ago, we noticed a need for patient assistance, more patient assistance, and more advocacy in our own communities. We were finding that the uninsured and the underinsured were being left in the background with no one to help them because there was not enough resources. They didn't know all of the options out there for them. And we spent our earliest days actually with our community's health systems, actually over the shoulders of the advocates who were doing it manually, and watching them, finding all of those pain points, asking them a lot of questions, and really collaborating with them as partners, where like they would say, hey, if we had this, if this would make it easier. Or, hey, this isn't working for me, I need help with this. I'm on the phone right now with the program, but a patient's coming in and I need to talk to this patient. Things of this nature, we were notating all of it and putting it all in a little database on our brains and figuring out a way to create a solution for this, to automate it. So that just ensures that all the patients have access to the best medical financial assistance. All right, so we didn't just stop listening there. So every health system brings a unique issue where you have to create a custom solution for them. And some of the issues we heard on repeat were changing applications for the programs, varying program policies, so where one program may require certain different documents, whereas another program may not require those same documents. And patient engagement, getting the patients to be able to give you those documents that you need, or picking up the phone, explaining their financial situation, them going to the banks and getting whatever it is that you need. We were finding that there was a lot of patient friction, and they weren't very happy or willing to give you the information when all you really want to do is help them. So not knowing the available assistance out there for your own patients as an advocate, it can be frustrating, and you're finding that your time to treatment may start increasing, and then patients are getting frustrated with you, or they might just forego treatment altogether based on cost. And that can be really upsetting. You're literally going home thinking about these patients and how they're not coming back tomorrow based on cost. All right, so there's an estimated $30 billion available in philanthropic aid and over 20,000 programs out there. Now that includes your government programs, your MSPs, so your QMBs, SLMBs, right? Then you have your philanthropic programs, so your free drugs, copay assistance, and foundations, and then your social programs, and that includes your transit, housing, and food programs. The enrollment process for these programs can be really complicated, and you find that the patients in those vulnerable populations tend to suffer the most, and they have the greatest need, but they don't have the ability to navigate what is required for these programs. And again, not having that patient engagement where they're not picking up the phone, or they might be too busy to pick up the phone, or they're not sure who you are, you might be calling to collect a bill on their medical debt. It really all can be frustrating, right? So this is why we at Atlas were committed to improving that health equity and addressing those barriers to care. And we do that by supercharging your efforts through automation. All right, so this is what we call our financial waterfall. This is where we're starting from the very beginning. We're catching those opportunities. We're solving possible issues that the patient may have getting treatment from the very beginning. So from registration all the way down to your hospital financial assistance program. This is very important. This is where we are optimizing the benefits for their insurance, and we're optimizing on those funds available. So we're going from the government programs, like we've explained, your MSPs, and then we're moving on to those copay cards, the foundations, then your free drugs. And we're going even further to those social programs. So are your patients not coming to get their treatment because they have no ride? Are you finding that your patients might be afraid that they don't have a place to stay tomorrow? Things like that. And then moving on to your hospital financial assistance, where we're actually automating that process for you, digitizing your own HFA applications and auto-populating the patient's information. Health systems go through and process charity applications by the hundreds for weeks on weeks, and we're automating that process for you. All right, so because prior authorizations are the prerequisite to getting medical assistance, we did want to address this situation. It can be very time consuming going through each one of these pre-cert applications and then having it come back with a denial that you weren't aware of, maybe you didn't include something. There's a lot of payer policies that differ from payer to payer. What we've done is we've created clinical pathways that are surfacing those payer policies to prevent those denials on the front end. So what I mean by that is your site of care, your ICDs, 10 codes that are preferred for those drugs, whether it's a biosimilar that they want. We can even customize it for your health system if they have a therapeutic interchange that they prefer. Okay, so we've done all of that, and what happens is when we're pulling that information from your EHR, we're actually automatically populating that patient information, their insurance. We are pulling that pre-cert for you, the digitized version of that pre-cert application, and it's already telling you, hey, this isn't indicated. Hey, you have to actually grab this document so you don't get that denial based on not having that document. And I do not know what it's doing here. All right, it wanted to move on. So with prescription assistance, how many of your patients are not filling that medication that they were just ordered? Whether it's from checking out at a provider's office, being discharged at the ER, or even just those discharge notes and orders from a long inpatient stay, how many of them are not getting that filled? Or when you're at a pharmacy, do you have a pharmacy team who's like, you don't have the resources, the team, the hands available to start going through GoodRx or looking at those different coupons to help that patient get some assistance to help them get their medication filled? What we do is we go on the back end, all in the back, where your provider's not getting any of that friction from this. And upon the order, it's actually looking through all of those coupon cards that are out there, matching that patient's orders up to those coupon cards, and then upon discharge, those coupon codes are printing off or they're being texted to the patient. Okay. So Atlas is an all-in-all, end-to-end solution. We are deeply integrated within our clients' EHR, so Epic, Meditech, Paragon, and we're pulling all of that information into our matching engine and matching the patients up to these different programs or finding that the patient needs a prior auth. We're pulling their out-of-pocket estimates. We're going through the enrollment, drug ordering, your claim submission, creating those friendly EOBs for you to submit to your copays and foundations, so you're not having to reach out to the payer to get that remittance or call the patient again and again and again to get their EOB. We're creating that for you. Also, we are very proud to say that we are HIPAA and SOC 2 compliant. No PHI is stored offshore. And we enable our partners with the tools to reduce financial toxicity by reaching more patients and making a larger impact on those communities. Okay, so you'll notice we have a sampling of the health systems in different markets. Some are small and in rural areas, and others in larger and more prominent cities. Okay, so here's this case study from one of our actually early adopters, and they're at King's Daughters. We actually increased their philanthropic revenue by 233%. And this next one is, I don't know that we're all allowed to have favorites, but this one happens to be a personal favorite of mine because it's from my home community. And we're gonna talk about champions in 1 second. When it comes to champions, this is as good as it gets. Like, you have perfect champion here, our CFO, Greg Jones, for Way Memorial in Jessup, Georgia. Definitely went through, realized that there was a pain point for his patients. He reached out to the team that was already doing their philanthropic program, wanted to know everything that they were having trouble with, and then was like, okay, now let's find a solution for every single one of those pain points, and that's how he found Atlas. All right, so going into that, what you need to do first, if you're an advocate and you're finding that you're struggling with these issues, first, identify those problems, and then identify the person who's going to help you. Now, this might be your champion, not necessarily the champion for the partner that you might partner with to help you with your financial program, but your champion as an advocate. So what you want to do is find that person who might be in revenue cycle or in pharmacy, someone who's monitoring these high-cost drugs, and they're trying to find the impact on patients. So that's the person you want to identify. Then you're going to be very vocal about your pain points and what's the problems are that you're coming across. And then you want to do your research, find those solutions that are going to help you with your specific pain points. Not one company is always going to be inclusive to exactly what you need. Everything's going to, you need to look at yourself as an individual, look at your health system as an individual. Medical assistance is a changing science, so you need to really be observant to that. And then schedule those meetings, have a demo, play with the product, reach out, get online, get on the websites, ask everybody you can, ask for referrals and references, and really have that conversation. All right, so that was really quick. That was way quicker than I thought it would be. All right, I'm actually kind of happy about that. So with this, so what we've done today is just really high level, have touched on some key features for Atlas, and we are at booth 218. I hope you enjoyed this super quick presentation. Thank you, NMAPA, for having us out, and if you have any questions, come see us at booth 218.